Okay, this time I want to talk about a sensitive subject, and it's sensitive to me because I was in this position myself. And I want to talk about premature babies. And I've had some friends who was first time mothers who had premature babies, and they didn't know what to do, you know. And this is not something that a lot of people talk about because if you have not been in this situation, you wouldn't really know how to deal with it. And it's a hard thing to deal with because sometimes you take the blame on yourself that you have done something to yourself to cause your child to be premature. Now, there are certain scenarios that is fact that you can cause your baby to be premature, and drugs is one of them, alcohol is another. Staying in an abusive relationship too can cause you to have your babies early. But what I want to say is when you as a woman have a premature baby, don't be fearful of that because God saw something special in you to give you this child. I know it's hard to digest. You got a lot of emotions going on with you and you don't know what to do. The doctors provide you the general book knowledge of what they went to school and they learned. But you as a woman has a maternal instinct for your child. So if your instinct tell you anything about your baby, please listen to it because 9 times out of 10 is leading you in the right direction. Premature babies can be scary depending on what the premature is and what the results of the prematurity or what kind of medical condition they end up being. My son was born 6 months early, 1 pound, 12 ounces. And he had a lot of things going on with him. He had a trach, he had G tube for the feeding. He ended up with osteomyelitis, which they found out later on. It started in one leg, it rolled over to the next. Um, the doctors told me he wasn't going to live to see the next day, but he actually lived 3 years. He was a chronic asthmatic. He always had respiratory infections. He had to have hearing aids. So because of the trach, he didn't talk. And because of the osteomyelitis, he had one leg longer than the other. What I want to tell you as mothers with premature babies, that feeding tube is okay. The doctors say if they take it out, put it back in. But if you let that feeding tube stay in too long, it will stunt them. They can't progress. It does something to them. I don't know what it does, but it slows down their progression for things they could do. So just think about that. I'm not saying take it out or whatever, but what I did for my son when he snatched it out, I left it out, and then he did a lot of more things. But you as a parent will know this. You will feel certain things. What I say to you is ask any questions that you need to ask to the doctors, to the nurse. No question is too dumb or too stupid. If you want to know, you need to know. You need to know for yourself and you need to know for your child. The next thing I want to say to you is keep a journal. Write down everything. If they go to the emergency room, what they're going to the emergency room for, what's the diagnosis, what kind of medication. If they end up in the hospital, um, put the date, the hospital, how long to stay, what was the purpose of going to the hospital. Again, the medication. If they're on medication, document all that. If they have physical therapy, occupational therapy, document that. And after it gets to be so much and you find yourself for some premature babies as they grow, you start having to call the ambulance, to get them transported to the hospital. Condense it. Make you a cheat sheet. So when you go to the hospital, the paramedics come in, you might be frazzled, you might not be in your right frame of mind, but that little cheat sheet will help you and it will help them to get the history of the child without you trying to constantly think about what happened, when, where, or how. And it will help as the child grow and progress in life, as you keep um, a tab on different things as far as medical, hospital visit, doctor visit, and medicine. And if something should transpire later on, or if they should get better, you just keep a good little record. It's beneficial to you, to keep a nice little trail. Because when my son died, they did an autopsy on him, and I had to explain every scar on his body. And luckily, I had, put down everything in a journal. So just know that that baby is special. Love that child for who the child is. And I'm telling you, if you love the premature baby, it is a beautiful thing. Your love from the mother to the child will heal that child, help it to progress further than any medicine or any doctor can do. But know this, premature babies are very smart. So please don't treat them like a handicapped child. Treat them like a regular child. They're very inquisitive. They get bored quick, so you'll probably have to keep, multiple things, introducing different things to keep them, entertained, because they get bored quick. Just love on your kid. You know, um, wish my son was still here, but he's not. But I thank the Lord for the time that I had. And hopefully this will help somebody who's questioning, why me? Well, why not you? Babies are a blessing. There are women out there who would love to have babies and they can't have them. So thank God that you were able to bring a life into this world, and that person is a part of you. So treat it as such. Love it to death. It will only get better. And just a smile on the baby's face, looking in your face, is worth more than gold. Have a good one.